Hi, my name's Michelle Gellis, and I am an acupuncture physician practicing in Florida in the USA. And I would like to thank the Traditional Medicine Conference for inviting me to present remotely today. I have recorded this presentation because I will be teaching in Colorado when the conference is going on. So I'm going to start sharing my screen with you. So today's presentation is titled The Foundations of Facial Acupuncture. And a little bit about me. I am a former faculty member and clinic supervisor at the Maryland University of Integrative Health in Maryland in the United States. And I worked there from 2003 until 2021. And I am currently on the doctoral faculty of Yosan University in Los Angeles, California. I am an acupuncture physician, and I have been teaching cosmetic facial and neuromuscular facial acupuncture classes internationally since 2005. Here are some of my publications. I've been published several times in the Journal of Chinese Medicine, and you can access those publications at their website. And also, I have links to a couple of these on my website, which is facialacupunctureclasses.com. So what is facial acupuncture exactly? The way that I teach facial acupuncture is I kind of break it down into two distinct categories. There's cosmetic facial acupuncture, which is pretty much for cosmetic purposes, revitalizing the appearance, creating more youthful appearance, revitalizing the skin, and neuromuscular facial acupuncture, which is something that can be used to treat neuromuscular facial conditions. And within cosmetic facial acupuncture, we have the acupuncture piece, and we also have facial cupping and facial gua sha. There are also other ancillary services that some acupuncturists will offer, like microneedling or red light therapy. But within the scope of this presentation, I am just going to talk about these three topics for cosmetic facial acupuncture. So cosmetic acupuncture has gotten quite a bit of attention in the media from celebrities. I only recognize a couple of these, but these are all celebrities who either in a movie or a TV show, or actually as a way of enhancing their appearance without using chemicals or neurotoxins, they have gotten cosmetic acupuncture and posted it on their social media. However, cosmetic acupuncture does not have to always involve a very lengthy process and a lot of needles. Now, these are all examples of what I consider to be not good facial acupuncture, and I'm not putting these up to poke fun at other people's work. I put these up because facial acupuncture can be practiced with very few needles as long as you are using precision needling techniques. You can enhance your appearance, your patient's appearance, and um, regain symmetry, get rid of dark spots, melasma, work with all sorts of sagging and wrinkles and things that happen naturally as we age. You can slow these things down. You can reverse them to a large extent, and it does not have to involve all of these needles. It's in most of these images, it's just too many needles. And in some cases, the needles, this is somebody's neck. This looks like it would be terribly painful. And also, the positioning of the needles is really not conducive to safety. This photo was taken in one of my classes. One of my students was treating another student and just showing kind of my basic cosmetic acupuncture techniques. These are some of the needles that I use, and depending on what's going on with someone, whether they have more sagging or wrinkles, you might add in more needles, but certainly not as many as were in that previous slide. So let's talk a little bit about facial cosmetic acupuncture. It's been used since the Song Dynasty. It's not some new trendy technique that these celebrities just stumbled upon. And as I mentioned, it can reverse the hands of time anywhere from 5 to 15 years. And it is based on Chinese medicine principles. It works with your qi and your blood and your body fluids and your organ systems. And the way that I teach it, I incorporate body points, and it's really wonderful for lifting the face, increasing collagen production in areas where you're lacking collagen, and it treats the whole person. You are giving your patient a full body treatment every time they come in. But the most important thing is to use precision needling and specific techniques, and not just assuming that because you're an acupuncturist and you have needles, you really know how to perform cosmetic facial acupuncture. I did include references and to some case studies that have been done and some journal articles that have been published over the years on cosmetic acupuncture and how it affected the skin, the appearance, the elasticity. Also, a big, larger study that was done in the Journal of Clinical Acupuncture, and some other studies that have been done. And hopefully you guys will all get access to my handouts. I'm going to provide them, and you can look these up if you're interested. So there are many benefits of cosmetic acupuncture for your patients. It works on the skin level to stimulate collagen and elastin, brings nutrients out to the cells, helps to reduce dark spots, increases blood flow to the skin. On the muscle level, it's going to restore symmetry to the muscles on the face. If there's any excess tension in the face, it can help to release that, increases the muscle tone So like in the neck, and all of these things work together to help to reduce wrinkles. And for the overall health, it creates deep relaxation, regulates the hormones, improves the digestion, and enhances immunity. Facial acupuncture also has many benefits for your practice. It can provide an additional source of revenue, bring in clients who may or may not would have come to see you for other reasons. And it can help your practice to stand out from the competitors, really position yourself as someone unique in um, in your community who's doing a natural way of enhancing um, the people's appearance, and you will have tremendous client satisfaction, and cosmetic patients are very loyal. They will continue to come for long periods of time, and it can easily be integrated in with your current practice with uh, the way that I teach the class. It's a 3-day training, it's 2 days of lecture, essentially, and 1 day of hands-on practice. And if you can't do the hands-on practice, I also offer remote classes, although I do teach internationally once a year. The protocols and techniques that are learned during a training are vital to the success of your class, of your practice. So learning how to evaluate new patients, how to talk to your new patients, safety, any contraindications and precautions, putting together a treatment plan, and then the actual protocol that you're going to use as far as putting in some auricular points that can help to calm your patient, putting in body points that can help to get to the underlying causes of some of their maybe accelerated aging, learning threading techniques, which is something we don't typically learn in acupuncture school, and then doing submuscular and intramuscular needling, and learning how to needle the different acupuncture points and motor points in the face. In addition to just thinking in terms of skin and muscles, fat, bone, fascia, part of what makes facial acupuncture so unique is we use our face to express. And so working with the underlying emotions that are going to show up on our skin and our face is important. And that is part and parcel of, I'm a Worsley trained 5-element acupuncturist, but I'm firmly steeped in TCM theory. So I combine the two to get to work with the emotional underpinnings of why a person might have different facial wrinkles going on, but also talking about the qi, the blood, and the body fluids, and how deficient qi can cause your skin to look withered. Stagnant qi these are examples, stagnant qi can cause dark spots or fluid accumulation, which can give you the under eye puffs, the puffiness under the eyes. Someone, for example, who has deficient kidney qi can have dark circles under their eyes. If they have stagnant liver blood, they could have dark spots on their hands, on their face, on their hands. Someone who has stagnant liver qi might be expressing anger a lot and get lines between their eyebrows from making that angry face. Someone with a spleen qi deficiency can have several problems, everything from sagging because the spleen holds everything up to fluid accumulations, from excess damp. Someone with issues with their lungs can have a withered appearance everywhere on their face, lots of wrinkles, dryness, and heart fire can show up as rosacea on the face and cause a lot of heat, which can in turn cause blemishes. As I mentioned, the face is very unique in that it has several layers, and the face is the only part of our body where the skin is connected directly to the muscles. So the result of this are facial wrinkles. We get wrinkles around our lips from pursing our lips. We get nasolabial folds from smiling. We get crow's feet from smiling. We get lines between our eyebrows from making that angry face, or if you're very surprised, you can get lines above your eyebrows. So looking at this picture, we have the skin, superficial fat, SMAS layer, then underneath that, there are retaining ligaments, and then bone. I'm going to do a quick video of how I might thread a wrinkle on the face. And so what I'm saying here, I have the volume turned down so that I can talk over it. Essentially, I like to squeeze a wrinkle when I needle it, and that makes it a little deeper. And when you're threading a wrinkle on the skin, you want to stay as close to the surface as possible. And then you are going to, so here I am, I'm squeezing the wrinkle, and I am just going to thread this very fine needle right into the surface of the skin. There's a close-up, and you can see it's very much at the skin level, and this will just plump that wrinkle right up and build collagen. That is a very old video. It's probably about 10 years old now. Other things that we do in cosmetic facial acupuncture are put these little intradermal needles in a very superficial skin level in order to stimulate collagen. Another technique that we use when working on the face are facial motor points, and motor points are located in the part of the muscle where the nerve enters into the muscle. And so, for example, and the good news for us is many of the facial motor points are acupuncture points. So the motor points, for example, for the mentalis muscle are a half sum lateral to REN 24. And these can be used if someone, if they have a lot of puckering in the skin around their chin, because these muscles can get very tight. This can happen a lot if people are very fearful, or if they pout a lot. And so treating, I have an entire 2-day class that I teach just on how to treat expression lines. So this is, these are some images for my upcoming book, which will be called Facial Acupuncture. And this is a split of a person with their face resting. And then here, when you make the expression, all the different muscles that are used to make that expression, and I've mapped them out and included the motor points that you would use to treat these different muscle groups. So here we have the corrugator, the procerus, the depressor supercilii. We have the levator superioris. We have the superior tarsal, which is kind of underneath here. And then the orbicularis oris, and then which acupuncture points correspond to the motor points to treat these different muscles to help them to get back into normal functioning. This was a student who I was demonstrating cosmetic acupuncture on her. I was doing some submuscular needling of the platysma here. And she had mentioned while I was working that she had previously had Bell's palsy, 17 years previous, and she was left with some residual loss of motor function in her mentalis, and she wasn't able to really purse her lips like when she would brush her teeth. So I went ahead and treated the motor point while she was on the table. And you can see as soon as I put the needle in, the muscle started to twitch a little bit. And then once I stimulated it, it really kind of took off there. She reported back afterwards that indeed her function of her, that portion of her face that hadn't worked for so many years was much better. She treated herself a couple more times, and it stuck. So it took. So some of the more common questions are, how long does a treatment take? And the way I teach facial acupuncture, your patient is going to be on the table for about an hour and 15 minutes. And you really only need to be in the room for about a half an hour total. The rest of the time, the patient is resting. And how long do the needles stay in for? Again, I do 15 minutes of putting the needles in. The patient rests for about a half an hour. Then the needles come out. I do cupping and gua sha, and then and that's it. Does it hurt? No more than any other acupuncture treatment. In most instances, my patients fall asleep while they're on the table. How long between treatments? My patients usually come in once a week. Is bruising common? Not at all. It certainly can happen, but it all goes back to that precision needling. If you're using precision needling techniques, your patient should not have any bruising. How many treatments? That's a big question, big answer. The answer is it depends. It depends on a lot of factors, but a good number is around 12 treatments, because that's how long it takes for the body to make collagen, about 12 weeks. Now, depending on how many signs of aging your patient has and what's going on with them, it could take less time, it could take more time. Facial cupping and gua sha has many benefits. And as I mentioned, I do this at the end of every treatment. It brings blood and qi circulation to the skin, which increases fibroblast activity, which stimulates collagen and elastin production. It helps release any tight fascia, any fascial adhesions, which helps bring the face back into normal functioning. It also helps to move out any stagnant lymph, any toxins from the lymphatic system, helps with redness like rosacea because it releases heat, and it also strengthens the vascular integrity of the face. Does it work? This is another question I get. This was a patient that was treated several times with cosmetic acupuncture. I think she also incorporated in a little derma rolling or microneedling just for more of the skin level stuff. But using various techniques to help to tighten the platysma and tighten the skin, along with the cupping and gua sha techniques, it can really affect the neck area in a very positive way. So this is what facial cupping and gua sha looks like. We use highly specialized glass cups and jade gua sha tools in my classes. And as I mentioned, can help a lot with these fascial adhesions, which can trap nerves and really wreak havoc on the appearance of the face. Here are some before and afters from facial cupping and gua sha. I also want to talk about neuromuscular facial acupuncture, and this is a separate 2-day class that I teach. And if I forget to say it, everything I teach is available as recorded webinars on my website, facial acupuncture classes. So if you're interested in learning any of these things, they're all available and they're all approved for continuing education credits. But things like Bell's palsy, stroke, TMJ, trigeminal neuralgia, MS, ptosis, myasthenia gravis, and there's a whole host of other facial spasms. Different things affect the face that can really be uniquely treated with acupuncture. And I use a multifaceted approach of facial motor points, submuscular needling, some scalp acupuncture, and facial cupping and gua sha to help to bring the face back into normal functioning. So I just mentioned all of these, and I mentioned submuscular needling a couple of times. I do some of it for cosmetic reasons, like if someone has a lot of wrinkles or tension in one area, I will do submuscular needling. But essentially, it's used to relax or to bring muscles that are overly tense or atrophied back into normal functioning. And it's wonderful for long-term paralysis. And essentially, you're going to take needles and you are going to work, in most cases, right underneath that muscle. It helps to release those fascial adhesions. It helps to bring blood and qi circulation to the area. So some of the muscles that I use it for are the corrugator, for the frontalis. I use it on the auricular muscles. I use it along the platysma and a few other muscles on the face. So for example, for the corrugator, you would just needle right underneath that corrugator muscle and it would look like this. This is a Bell's palsy patient that was successfully treated with facial acupuncture. And she had had Bell's palsy for quite a while, wasn't getting a whole lot better. So it really can be quite beneficial, especially for your hard to treat patients. I've listed here all of the different classes that I teach. My website is facialacupunctureclasses.com. And again, all of my courses are recorded. If you choose to take a live class, I do teach. I have taught traditionally every year for the past couple of years in Australia. I'll be back in Sydney this year. And right now in 2025, I don't have anything on my schedule, but I should be in Europe. And I teach all over the US. I teach 1 to 2 classes per month throughout the year, except during the summer, but these are all available as recorded classes. I have a basic and advanced facial acupuncture certification, facial cupping and gua sha, derma rolling, skincare, treating neuromuscular facial conditions. I teach about how to treat those facial expressions and some separate advanced techniques as a separate module. I have an ethics and a safety, 2 different classes, red light therapy, and also I teach microneedling. So these are some of my students from some of my trainings in different places. And this is just a mock-up of my book. Right now I'm working with the designer for the cover. The book is written. The layout is being done as we speak. And my website is down there on the corner. I will be taking pre-orders for the book, most likely in August or September. You can go to my website, facialacupunctureclasses.com, and if you go on to the contact us, you'll be added to my mailing list, and you may be able to receive one of the first 100 copies, which will be signed. Oh. Again, I want to thank you. Say thank you to the Traditional Medicine Conference for giving me this opportunity, and I hope everyone enjoys their conference.